Whether you're talking to someone or glancing in a mirror, what do you notice about a person first? For most of us, usually the eyes, right? That's why so many people go to great lengths to keep them looking young. Nikki Rasmussen is a registered nurse and the owner of Yolo Laser Center and Med Spa, and is back with us today to talk about the eyes of March. It's great to have you back with us.
Thank you. It's lovely to be here.
All right, eyes, really important, right? What do people say about it when they come in to see you?
Eyes are the window to the soul, and it's one of the first things we notice, and it's one of the first things actually to show the signs of aging. The most common complaint is I have dark circles, or I'm starting to get hollows underneath the eyes, or a functional issue. My eyelids are starting to droop and come down, and it's affecting my vision as well as my self-esteem.
All right, you actually have this fabulous procedure. It's called laser eye rejuvenation.
We do. Laser eye rejuvenation is a combination of treating the upper eyelid. It treats droopy eyelids as well as crepey skin, and also a technique that we use to resolve under eye issues.
Now, how would you describe this? You say it's like surgery using laser instead of a scalpel.
It is. There is no scalpel involved, yet it is a surgery. It's very high tech. We're one of the few that are doing it in the state of Connecticut. It's done by our board-certified plastic surgeon, Dr. Pathy, and he's using a laser, and I believe you're going to be showing video later on of the procedure, so it results in less bleeding, bruising, and downtime. It's done wide awake in the office.
But you mentioned Dr. Pathy, and it's really important that when you do have some sort of a procedure done anywhere in your body, you really should go to a board certified.
I believe so. He is a double
surgeon.
board certified plastic surgeon. He's Yale trained, and he's meticulous. We love to have him here.
Absolutely. All right, let's first take a look at the dark circles.
The dark circles.
And this is something a lot of women talk about, and what are we looking at here?
This is actually my eyes, and at the age of 41 I started
to develop.
They are. It was overnight. Basically I started to develop hollows and dark circles, and I asked what we could do about it, and then you're going to have an after picture. This was no downtime with no surgery. This was
amazing.
Yeah, it was an instantaneous. It was a light laser rejuvenation of the lower eyelid, and then a little bit of filler put into what we call the tear trough area.
And you said that there's no downtime.
There was no downtime with this.
So how long did it take, the actual procedure?
The actual procedure was just under an hour.
And you were able to go home after that?
I was able to go home. I did have to put a little ointment underneath my eyes, and I was slightly red, but in the traditional sense, I went back to work the next day.
Okay, so how does that feel when they're doing the procedure? What do you feel?
It was painless. It was a simple little pinprick of an injection, and that was it. He iced it before. We had a little topical numbing cream on, and it was as simple as that.
Goodness. Okay, let's go to the upper eyelids.
The upper eyelids.
Yes.
This patient here had a functional issue. It felt like her eyes were tired, that her lids were droopy. Normally people would have an upper lid blepharoplasty to treat this possibly in the operating room. Now we're able to do this in our office using the laser. So this is the after picture. So we did an upper eyelid blepharoplasty using the laser, so there's no scalpel involved. And then we did a lower lid rejuvenation just to tighten up the skin.
And this person was wide awake for this entire thing?
She was wide awake. She got to listen to her choice of music, and she went home right afterwards. She actually only took one day off. She's a fitness instructor. She went back to work. There is some swelling involved, and downtime is, very independent, depending on the person that we're doing, the individual that we're doing. But really, it's a lot. It's a very simple in-office procedure.
She looks just refreshed.
She looks refreshed. We're not about making people look like somebody else. It's basically them about 5 or 10 years younger.
All right. Let's take a look at some of the video that we also have here. And what are we looking at here?
Right here, this is Dr. Pathy just making the markings, which is one of the most important parts of the procedure. He's looking at the face and noting any asymmetry if you're heavier on one side than the other. And he measures and then makes careful markings that are used during the next portion of the procedure. So lying down, he does it while she's sitting up as well as lying down to carefully mark the portion that's coming off.
So he's working on the upper eyelid?
Right now he's working on the upper eyelid, exactly. So And right here, now this is what I'm talking about. There's no scalpel involved. This is the laser actually making the incision. And there's, as you can see, it's a very clean procedure. There's no blood, very little bruising involved, and they commonly just get swollen after the procedure where they go home and they put some ice.
Again, she's wide awake through this entire thing.
She's wide awake.
So
she's listening to music.
Not under general anesthesia.
Right. It's not necessary for the upper lid, so she's wide awake. There's no risk of general anesthesia and a short recuperation.
All right. A lot of people say, how can I prevent dark circles, hollows, this upper eyelid issue? Is there any way you can prevent that?
I'd say there are ways to prevent. One of the most important things is start to get sunny. Put your shades on.
I do that all the time. I'm always wearing my
along with sunscreen,
sunglasses.
because you can't really get sunscreen close to the eye, so put on your sunglasses. Also, we recommend the Clarisonic Opal. This is a device made by the makers of Clarisonic, and it uses sonic technology to actually hydrate and plump up the area around the eye. And if you don't mind, I'd like to try it on your hand.
Sure.
So there's a little serum that it comes with.
Okay.
And it just is vibrational. And underneath the eye, it just feels wonderful. It helps with swelling. It helps reduce fine lines and puffiness, and it's timed, so you know exactly how long to use it on each eye.
Oh, it feels good.
Yeah, it feels nice.
Like
so
a little
just
massage.
like a little massage for your eye. So it's a very nice, non-invasive way to plump up the area around the eye and help reduce fine lines and wrinkles.
You also have some specials for our viewers.
We do. One of the important things around the eyes when you're talking about eyes are your lashes. So currently we have a special on Latisse, which is FDA approved to grow your lashes, and we have a buy one, get one free. And then we also are running specials on our Eyes of March laser rejuvenation, which can be found on our website.
Perfect. We're in March. Eyes of March. All right, for more information, Yolo Laser Center and Med Spa is located in Guilford. The number is 203-533-4560, or visit yolomedspa.com. Nikki, thanks for being here.
Thank you.
You're welcome.